In those people who we find that they continue to have recurrent AFib, recurrent arrhythmias, oftentimes we'll monitor indefinitely. We'll put in a loop recorder, and then when the battery expires, we'll actually take it out and put in another one because we're still doing stuff with that information. If we're still adjusting medications, if we're still monitoring symptoms, sometimes we will actually monitor indefinitely, and the patients are not only okay with that, they actually like it. Sometimes because they know somebody's sort of keeping track.
I think it's really important to appreciate that atrial fibrillation is a chronic progressive disease. I think of atrial fibrillation as similar to diabetes or hypertension. And with those types of patients, we ask them to monitor their disease state quite closely over a long period of time. I really think we need to treat atrial fibrillation the same. Long-term data allow us to effectively manage the disease, and spot checks of the rhythm every few months or once a year don't really allow us to provide a sophisticated, tailored approach to that patient's care.
Know that atrial fibrillation is associated with stroke and stroke risk, and the higher the AFib burden, the higher the risk of stroke in people who are not on anticoagulation, and studies have shown that. And also, we can measure the success of our therapy, and particularly for ablation, by just looking at the first time that patients recur. We can look at the total burden, which is really the best way to do it, but looking at just symptomatic recurrences will grossly underestimate in most instances how much atrial fibrillation someone is actually having.
But our laboratory was the first to introduce a concept of very late recurrence of atrial fibrillation, which is patients who had no atrial fibrillation in the first year following ablation, who then start to have recurrences of atrial fibrillation. And this is a concept, again, called very late recurrence of atrial fibrillation. So we believe that patients need some sort of monitoring for years after an ablation to really ensure that they've achieved a long-term benefit from the procedure.